name is Corey, and this is Danielle. I'm in 318 class, corrective exercise. What we're gonna go over is knee valgus with the single leg squat. Okay, so first off, talking about what is knee valgus. So knee valgus is actually characterized by the knee collapsing inward when your hip flexes. And then it's a lower leg deformity that exists when the bone at your knee joint is actually angled out and away from your body's midline. Okay, so we're gonna do the single leg squat assessment, and a little background with the single leg squat. It assesses dynamic flexibility, so your core, balance, and overall neuromuscular control. So what you're gonna do, how it's placed, you're gonna have your hands right here at your bend line. What you're gonna do, you're gonna stand on one foot. You back up a little bit. Back up. You're gonna stand on one foot like this. Okay, and what you're gonna do, this is a perfect squat. You're gonna come down to right here. You're gonna try to do it. You're gonna do it inward. Okay, so you're gonna do it repeatedly 5 times. 1, 2, 3, 4, 5. Next leg. 1, 2. So you actually see that her knee is moving inward. That's a sign of knee valgus. 4. So after we saw that it was knee valgus, we're gonna actually go over the 4 steps of the corrective exercise. So the first step is inhibit, so it's basically foam roll. Second step is limping, so stretch, and then activate and integrate. Okay, so first off, we're gonna go over what muscles are overactive. Okay, overactive are the adductor complex, the bicep femoris, the lateral gastroc, and the vastus lateralis. Okay, now the muscles that are weak are the gluteus minimus and the gluteus medius. Okay, so in terms of females, since their reproductive system, they usually have wider hips, and that could be a cause of knee valgus when they're moving inward. And also, if you're flat-footed, if you're an athlete, usually knee valgus happens along with athletes that are flat-footed. And then also, if you just have a growth spurt. So if you have a growth spurt, that could be a cause of. So we're gonna go over the inhibit stage of the testing. So now, since we already did an assessment, we already went over the overactive muscles. Overactive is the adductor complex, the bicep femoris, TFL, and lateral gastroc. We're gonna focus on the bicep femoris, myofascial release right now, okay? So what you're gonna be doing, you're gonna hold this position for about 30 to 60 seconds. So you're gonna come right here, okay? Let's say it's your right leg. Let's say it's your left leg. You're gonna come right here, hands on the floor. Okay, you're gonna lift up. You're going to abduct your leg just slightly, and you're gonna roll until you feel it. When you feel it, hold it there for 30 to 60 seconds. You're gonna roll slowly. The whole point of this is going slow. A lot of people in the gym, you see, they just do this. Yeah, it might feel good, but that's incorrect. Okay, you're gonna go slow. So I want you to try it. So yeah. Let's focus on your left leg. You're gonna abduct a little bit for the bicep femoris. Lift up, and you're gonna, slow, just like that. Nice. And when you feel it, you can hold it. Just like that. Now we're gonna go to the second stage, and that is going to be the lengthening. Okay. So what I want you to do, okay, I want you to push your right leg forward. Okay. And I show your left leg forward, and I want you to externally rotate your hip. Okay. And be an abduction. What you're gonna do, your pelvis is gonna be straight, okay? And then you're going to move your knee forward, just like this, okay? Now, this is stretching the TFL, lengthening the TFL. So you're gonna do this a couple times, hold it, then you're gonna relax, okay? So let's focus on your left leg. Externally rotate, foot down, this foot flat, okay? Abduction, and then you're gonna lean forward. Keep your pelvis straight like this. Okay. Now you should feel it. Do you feel it? Yeah, TFL? Nice. Do that for 3 sets. We're gonna do the third stage now, and that is the activation stage. Okay, so we're gonna work on the bicep femoris. You're gonna keep your leg on the ground, so flat on the ground, this one. Okay, you're gonna put this one up, this one, okay? And then what you're gonna do, you're gonna grab this leg right here. You're gonna feel it, that tendon. Yeah, you're gonna grab it. And what you're going to do, you're going to laterally rotate your leg, okay, just like this. And you're gonna basically lift up your leg. So you should feel it. That's how you activate, okay? Now keep on going down, go down, come up. Do you feel it right there? That's the activation stage, okay? So this is the stage where you're gonna do a couple sets, probably around 10 reps, okay? Nice and slow, so right here, and come up, boom, any position. Okay, now we're gonna go to the final stage, and that's the integrative stage. So for the integrative stage, we're going to basically reteach the functional movement patterns. Okay, it's gonna be slow and focused. For this stage, we're going to go over this exercise. So what she's gonna have, she has a band on, okay, over her knees. Okay. Now what she's going to do, unfortunately, I don't have a ball with me, a stability ball, but she's gonna place this foam roller right here, okay, just like that, right there. And then what she's going to do, she's going to go into a squat position. This keeps her knees from going inward for knee valgus. So you can practice this for like 3-4 sets. I say 10 to 12 reps. So what you're gonna do, go do a squat, nice and slow, yeah, come up, do it again. Nice and slow. And you see how her knees, they're not going inwards like she was for the single leg squat. She's literally going bounce. She's balanced. Nice. Good job. Couple more reps. Good job. Nice.